Good morning. It's Friday and it must be time for another update from the North Carolina Medical Society. We're happy to report to you this week about lots and lots of engagement by doctors in the listening tour with the Department of Health and Human Services on the Medicaid Reform proposal. We've been focused out west this week with Silva and Asheville and Boone, then last night in Greensboro and today in Winston-Salem. We've been very fortunate to have doctors stand up and talk about what they need out of a program moving forward to continue to take care of patients in a meaningful way here in North Carolina. If you've not been able to show up at one of the meetings, you still have until April the 18th to send in written comments. So I'd encourage you to take an opportunity to go online, click through. You can either email your comments in or by snail mail your comments in, but you have until the 18th to get that done. We now turn our attention to going east. So we'll be at meetings this next week in Wilmington, Greenville, Pembroke, Elizabeth City. So look for those dates as well, and if you have an opportunity, I hope you'll join us at those meetings. North Carolina Medical Society will have staff at all of those upcoming public hearings, so look out for us and connect with some of the staff members while you're there. Next week, we also have the Legislative Oversight Committee on Health and Human Services as well as Medicaid meeting on Tuesday, so next Friday we'll have a big update for you from those two committee meetings. This is the final joint Legislative Oversight Committee meetings before we start the legislative session on April 25th. So this is the week that we'll be seeing recommendations coming out on any legislation or bills or budget items that they would like to see done as a committee during the short session this year. So very likely to be some good news that will come out of that. Finally, I would recommend to you today, just as we talked about last week, that now's the time to be thinking about showing up for a White Coat Wednesday or becoming Doctor of the Day. By showing up for a White Coat Wednesday, you can sign up with your specialty, and many of those have already started to schedule days in May and June to come to town and advocate on behalf of the profession. Or you can just call us up and say you want to come individually, and we can pair you up with folks on any Wednesday that you could possibly be here. You only have to commit to a morning, most likely. Most of the committee meetings and the times that you can see legislators are in the morning before they go into session in the afternoon, so that gives you time to get back. Some doctors are even able to see patients in the afternoon on that Wednesday. So look at your calendars, see if there's an opportunity for you to join us bright and early on a Wednesday morning and be back in your practice in the afternoon seeing patients. Also, if you could take a whole day out and be Doctor of the Day and really see what happens with the legislative process and have floor privileges to see what's going on there, we would encourage you to sign up. That is a unique opportunity that only doctors and nurses have to be on the floor every single day, recognized as the doctor or nurse of the day. If you want to do that, all you have to do is call the Speaker's office or email the North Carolina House Speaker of the House office, and they will sign you up for an open day there as well. If you have a hard time getting a hold of them, you can always reach out to us and we can help coordinate with that. So we look forward to seeing you on the road this week. We look forward to reporting to you on the next piece of the next steps that we'll be taking with legislation in the short session and getting ready for April 25th. Talk to you soon.